So when I was in high school, it wasn't until like 10th grade that I knew nursing was what I wanted. And I started trying to learn like what classes I needed and things like that. And then when it was time for me to apply to schools, I sent out, I want to say like 5 applications. And I did them on my own. I had a guidance counselor who wasn't really there for me, but he did reach out and say, we have money to cover your application fees. And I told him how I already sent them out, and he's like, well, just come. He didn't even know what schools I applied to. That's the relationship we had. And so he looked at my schools and he said, none of these, he said, I don't think any of these schools are going to accept you. The community college might accept you. And I was devastated because I was like, I want to go to college. What am I going to tell my parents? I didn't know what I was going to do. And all the schools accepted me except for the community college. They put me on the waiting list. The reason I share that is because it wasn't until I started working on my PhD that I realized that there were so many barriers that were put for me not to even get to that point. And it was almost like nobody expected me to even think about getting my PhD because I was never encouraged to do that.
Barriers don't just start at nursing school. It's very easy to look at admission criteria, even in the school that I teach in, and say, this admission criteria really advantages people who are well-resourced and disadvantages people who are not well-resourced, people who have to work while they go to school, people who maybe can't pay for tutoring, maybe didn't have the best school education because of where they lived. So we already have that advantage at the entry point of nursing. But as I've really explored and looked at barriers, there are lots of barriers, just even in the way in which we fund education in the United States, that advantages some learners over other learners. But I have found that a big part of it is the people who are interacting with learners before they ever get to the nursing application, right? So counselors looking at somebody and going, this Black learner or this Hispanic learner who is English as a second language is not going to do well in an RN program with no knowledge of them at all, and funneling them in that direction. And so we're eliminating people who have excellent potential as nurses based on these false barriers.
So at Mercy, we are starting a program where high school students, scholars, can actually take one course, a 3-credit course, every Saturday for 15 weeks, and get 3 credits under their belt. And we provide a grant that allows you to do this because, if you take the courses before you come into the institution, they pay $200-300 for the course, right? Because they're high school students. You come to Mercy after you graduate high school, you have completed your first year of prereqs. Right. You are guaranteed a seat. More schools need to adopt that.
Mm-hmm. Yes.
We have an opportunity in nursing, especially with the shortage, to bring students in their second year of nursing. If we work and partner with the community and high schools and allow students to take the prerequisites for nursing in 11th and 12th grade, in 3 years now that you come into college, you can graduate. That's huge.
One of the things that I'm starting to do at Georgetown is actually partnering with our high schools, particularly those that have health academies in the DC area, because I think that is truly right. And with our curriculum, since we've gone through some revision, I wanted to be more friendly for transfer students in, where previously it wasn't. So when a student completes 2 years, they can transfer it in the junior year. Before, it was very rigid and it didn't allow that fluidity. Now it does.
Roberta, I love that you're going into the community with Georgetown University, because I was a graduate of a similar program of what you're describing, going through prerequisites during high school, graduating. I became a nurse at 19 years old. So when people are like, oh, you look so young, I'm like, because I am. Right? I've been in this game for a while. I graduated a while ago. But it's because I had nurses in my family that I knew the benefits of becoming a nurse. This opportunity was granted to my high school, and I was the only student to apply. Wow. The only student. So I think getting to the middle schoolers, getting to the younger demographic and their parents to say, this is what nursing means, and this is how we'll get there, and this is the support that you have to become a nurse. I think that's critical.
We look at our professional nursing organizations, whether you're talking about American Nurses Association, NON, MBNA, Filipino nurses, they do a great job with scholarships to support current nurses. But what we don't do is we don't reach out to those people that are in the pre-nursing stage, right? So for instance, when I was going to community college working and getting all my classes done, it would be great for me to have resources so that I can understand how is it, like what program should I apply, what classes should I take, talk to other nurses. When I entered nursing school, I didn't know any nurses. Not one nurse. I didn't know what nursing school would be like. I was like, what do we do? Like, do we just work in a hospital all the time? I didn't know anything about it. And so creating this program, Breaking Down Barriers, I'm really targeting those people in pre-nursing. So those people that are getting ready to apply to nursing school. Those people that are in junior and senior year of high school, where I was when I was exposed to the health academy at my high school, right? And really bringing in these conversations to them, right? The resources. So we bring in nursing programs from around Sacramento area. We have like a hosted lunch. We have panels. We have keynote speaker. So our panels focus on new grad nurses, nurses at the bedside, advanced practice nurses, and nursing students. So you could hear stories that resonate with you, these stories that you could connect with. We had a gentleman as a new grad nurse. He's a Latino male working in the NICU, the neonatal ICU. That's not very common, right? And so for him to share his story where his parents were migrant workers, and in fact, he worked as a migrant worker during the summer in between, school, is incredible. We have people that are going on second careers. We have people that are single parents. We have people that came in as English as their second language, right? So many people going through barriers or have overcome barriers to get where they are in nursing. And so to kind of share that conversation with others and to really change the image of what nurses are away from the bedside and share that with the larger audience of those people that might be interested.